March 14, 2012, my son Thomas lost his battle with the disease of addiction. I now belong to a club that no parent should ever belong to. Do you know the signs? Do you know the trends that children are doing in today's world? Do you know the signs and symptoms? Do you know the signs and symptoms of drug abuse? I want to empower and educate Long Islanders by bringing a force of professionals and how to prevent the disease of addiction. Long Island in Crisis. Good evening and welcome to Long Island in Crisis. This show is dedicated to educating and empowering family members of people struggling with the disease of addiction and those suffering with the disease of addiction. We spend an awful lot of time talking about the opiates and the heroin epidemic that certainly took my son's life, but ultimately it is the disease of addiction that is taking especially our young generation away from us. So tonight we're going to talk to my two special guests, Mary Silberstein from Central Nassau Guidance and Elaine Economopoulos from Horizons in Smithtown.
Yes.
And both agencies are not-for-profit, correct?
Yes, that's correct.
So people without insurance can come to you and get counseling and get help, and insurance doesn't necessarily have to be in place.
That's correct.
Okay. So because, you know, we fought for that in 2014, and insurance companies, you know, as well as I do, are still finding a new way to say no.
Mm-hmm. Yes.
And especially with 3 days in detox or 7 days in inpatient rehab does not cure heroin addiction.
Right.
Takes long time treatment.
Mm-hmm. Which is one of the reasons why we came up, Central Nassau Guidance, also known as CN Guidance, came up with the idea a couple years ago to go before the Suffolk County Legislature and do a presentation asking for funds to be able to do a brand new pilot program which would offer ancillary withdrawal services and do it in a manner which would allow for folks to be able to come to CN Guidance, be able to be induced on Suboxone or Subutex if they were pregnant women,
Okay.
over the age of 18 certainly.
So I'm going to start. So Suboxone is just replaces and takes away the craving for the opiates.
Yes, but it also allows somebody to withdraw from their opiate or heroin use, the opiate RX
Right.
prescription or the heroin without the pain.
Without the pain.
So
Okay.
it allows
I just
them
want
to be
people
able to,
understand.
yes, it allows them to be able to, be able to still function and to be able to get the treatment that they need.
Because the insurance companies do say you won't die from detoxing from opiates, but I know a lot of parents that have lost children because they committed suicide while detoxing, because you won't die from it, but you want to kill yourself. Is basically
It's very painful.
It's very painful.
It's very
painful.
uncomfortable. Yeah. So we were able to present in front of the Suffolk County Legislature, and as I said, they provided us with this pilot funding to be able to set up just the induction phase of a program. And not to get into too much lingo in regards to, we're both Elaine and I work for, we work in programs that are certified by New York State Office of Alcoholism and Substance Abuse Services, also known as OASIS.
Yes.
We are both similar programs. And we were able to do a collaboration with the blessing, if you will, from OASIS as well as from Suffolk County, to where we're in the same location. And we are able to do the induction phase of treatment.
So the
And then-
Suboxone.
With the Suboxone, sorry.
Okay.
And then we're able to hook them up while they're in our program to Elaine's program so that they can, once they're finished with the Suboxone induction, they can go right into treatment.
Excellent.
So it's that warm handoff. There's no wait in regards to getting into outpatient treatment. And Elaine also, which she'll talk about, she also has a prescriber who does the Suboxone, so the person can continue on the Suboxone once they're in her program.
I want to ask you a very interesting question. The prescriber, do the prescribers stay in contact with you so that they know that the patient is doing both?
The prescriber is part of my agency.
Okay, beautiful.
So the beauty of this, and the person could come to my agency because if this is their geographic area, certainly they could come into Horizons. But if they've come into Smithtown from another district, we would certainly work with them to find a program that is more convenient for them. So not all of them are going to come into Horizons, but we are right there in the same facility. So we engage the client and we do that warm handoff. And we try to assess what would be best for this person at this point in time.
Location.
Location,
Right.
right, transportation, all of that is very important because you know this is going to be a longer-term
Yes.
treatment program. This is not a quick fix.
Right.
It's not the magic pill. We know we get better outcomes when treatment is in conjunction with the medication. You don't just take the medication and think it's over. You need the treatment. So when they come into Mary's program or G and they get induced, we then pick them up at the end of that 2-week program when they're stabilized. We then can continue with the medication-assisted treatment while they stay in counseling. And that's
How many
where
days a week do they come for counseling?
Well, at the beginning, we're going to work with them in individual to complete a full assessment and to make sure that they've got all their needs taken care of. And from that point on, it could be anywhere from 2 to 3 times a week initially.
Okay.
Yeah.
And then I'm guessing that you encourage them to also go to a 12-step program and do meetings on other days?
We absolutely encourage for them to start looking at their lives and make the changes they have to make. And part of that is including sober support systems.
Right.
Yes.
And it could be a 12-step program, which are very convenient to my agency, or it could be another type of sober support that they have found for themselves and have worked through with their counselor. So
Excellent.
it's not exclusive to the 12 steps, but certainly it's encouraged.
And what's also wonderful about Elaine's program is that she involves the family members.
I was just going to ask,
Yeah.
because without involving the family members, they are usually, in someone's enabling,
Right,
typically.
right.
Um,
We attempt to work with the family members. Frequently, it's adults that you're working with, so sometimes it's not necessarily the parents, but it could
Right.
be parents.
yes.
Or it could be a significant other, and absolutely we try to work with them because they're as impacted by this disease. As a matter of fact, Horizons has a very unique program that has been designed to treat just the family members when the addict or the person in need is refusing treatment.
Oh, that's awesome.
So
Yeah.
often,
She has a wonderful program called Per Others.
per other, parent as a significant other, because we get those phone calls
Yeah.
where there's this parent who's so distraught, who's so frightened and upset, knowing that their son or daughter is so in need of treatment, is in a dangerous place, what to do. And most often an agency will say, as we did years ago, have them call us. And that call never comes.
I know.
And we leave that parent on the side. And what we've decided is, no, come in. Why are we waiting for the sickest person in the family to lead them into treatment? Take what they give you. I've got a mother who wants help. Come on in.
And you know what happens? When the family starts to do that and has their own healthy boundaries,
Yes.
that person in need of treatment is going to do one of two things: leave the home or engage in treatment.
Right, exactly.
Right.
One or the other. But I get those calls all the time, and I'm not a counselor, but I always go to what I did, but you always need to take your life back.
Yes.
You
But I
have
think
to
also-
be able to take
Yeah.
your family, your home back. needs to, because especially if there's other children involved, the siblings have voices that go unheard, and they have an awful lot of anger, and they have an awful lot of, I could be getting, I could be an A student, a student athlete, president of my class, and nobody knows I'm
Right.
alive.
Right.
Right.
But as you also know, I mean, there's so much confusion.
Yeah.
There's so much, where do I turn to? What do I do?
Stigma.
And there's stigma and there's shame.
Yeah.
And there really is that, I don't know what to do. And I think that the beauty of a program like Elaine's, a program like mine, also in Hicksville, because I have a full treatment program that also does the induction, but we also offer treatment in our Hicksville site. We have a free family component, so that people can come in from the community. They don't have to be a patient or a client. They can just come in on a Wednesday night. They can go through some psychoeducation, and then they can be part of a support group. They can come into treatment, or they can just stay with that support group. And it's allowing them to be able to reduce the stigma, reduce the shame, reduce the confusion, feel as if there's other people out there that are similar to them, which is so...
It's a relief to
Right.
find other people that are in the
Yes.
same boat as you,
Yeah,
because
Yeah.
no one understands the insanity of the roller coaster that you're on,
right,
unless another family in that same crisis.
right.
Right.
Because I'll speak from, people would say to me, well, take his cell phone away. Well, that's effective. You have no idea what, This is not a 6-year-old.
Right.
This is somebody that can, you can't talk about what you don't know what you're talking about, because the solutions
Right.
are not that black and white. But to find other families struggling, and then if you have an idea and you may walk out with 3 ideas,
Right.
as opposed to having none.
Yeah.
And the support that you could call somebody during the day and say, I need to vent.
Right,
That's the most important part, and the stigma.
right. Well, I think that if we're going to talk about medication-assisted therapy
Yes.
or treatment, I think that, there certainly are a lot of prescribers out there that are privately doing it, as well as in programs, and there are those that are doing an excellent job. But there's also what we call the doctor in the boxes, who are giving the Suboxone, not insisting on treatment, and the person...
And also getting cash for that prescription, which is a
Yes.
very interesting concept.
Yes, and quite a
isn't
lot of
it?
money.
Yeah, $300-$600.
Yes.
It's
Yeah.
insanity.
Yeah. So it's...
I'm going to encourage everybody that's watching this that there are a lot of places that you can go to get the prescriptions done the correct way.
But there's not a lot of places where they can get induced on Suboxone. A lot of the treatment programs, especially the funded ones, they have the prescribers who can do the Suboxone maintenance, if you will,
Okay.
but they can't, because they can't afford to have a doctor 3 days a week or a nurse, an RN 3 days a week to be able to do the induction.
Okay.
So that's another beauty of the pilot program that we have, that the Suffolk County Legislature assisted us with, to have it to where we can do the induction, and it's not going to be $300, $400, $500, $600. It's going to be either covered by insurance or Medicaid, or if it's a self-pay, it's going to be an amount that they can afford,
A sliding scale.
a sliding scale. So
That's awesome, because there are a
Right.
lot of people that are in need of this kind of information. Because I remember looking for Suboxone for my son,
yes,
and there's a place on the corner in Smithtown, the Doc in the Box, one of the emergency cares, $2,000 to come in
wow,
to be
yeah, that's too much.
for the
Yeah,
initial,
yeah.
and then it would be
Right.
$600 a month.
Right. Right. And again, once they've now transferred into the treatment component, we also work with the same insurance companies, Medicaid, and
Sliding scale.
sliding scale. So it's going to be affordable. Nobody is going to not receive the services they need because of an inability to pay. They're going to continue to get service, they're going to continue to get their medication, and they're going to continue in their recovery.
And the other piece to add about this great pilot program is that, we work very closely with Elaine and Elaine's program, but we'll also work very closely with other programs as well. So if Catholic Charities, for example, in Comac, or the Y, they're not in Center Reach anymore, but the YMCA has a program. Or if there's even a program out in, like Alternatives out in the Riverhead area.
Okay.
They will be able to send their clients to us. They can't be co-enrolled,
Okay.
but they can, let's say they've assessed somebody and they see that person should have a Suboxone induction or that's recommended. They can send them over to us, we'll do the assessment. If we deem that they're they have to have, in order to come to us, they have to be in mild to moderate withdrawal.
Okay.
They can't be moderate to severe. If they are, then they have to go to an inpatient detox.
Okay.
So we're able to, from mild to moderate, we're able to bring the person in, provide them with the Suboxone induction, work with them for 2 weeks, and connect them during that 2 weeks' time back to the agency that referred to us. So, for example, if it's Alternatives, they'll be referred back to Alternatives in Riverhead.
That's awesome.
Yeah.
We'll be right back after this message.
I think this is a good time to tell you. You're doing okay, Mom. I can call you Mom, right? I know we haven't known each other very long, but you seem like a real keeper. You're not perfect. There was that strained carrots incident, but you're trying. You pick up my bottle every time I toss it out of my stroller. That's high comedy to an 8-month-old. You hum the Barber of Seville when you wash my hair. So cool. And your rub-downs are out of this world. Anyway, I want you to know how much I appreciate you. You know, right? How much I love you? You're doing okay, Mom.
Hey, I'm Tom Mealy, once again coming to you from the fabulous Madhouse TV studios here in Deer Park. And this is about the Mousetrap Cafe. Now, I know that everybody's excited. Everybody wants to get in. Everybody wants to book parties. People want to experience what we're going to be offering in the village of Amityville. Unfortunately, folks, there's been a slight delay in construction, weather conditions. It's pushed us back a couple of weeks. So just bear with us. Trust me, the experience is going to be exciting. But what I want to talk to you about today is the amount of people that are calling looking to book private parties. Yes, we would love to have you, and we'd love to have you experience the Mousetrap. So this is what I want you to do. Due to the overwhelming response and the amount of people booking, whether it's a private party for a wedding or whether it's a bar mitzvah, whatever the case may be, I want you to get on the site, go to our contact page, send us an email. Let us know the date and the time that you'd like to book and the amount of people. We will respond promptly and we'll get back to you and we'll tell you whether or not that date's going to be available. Lock it in now. It has been surreal on the amount of people that have been calling us, emailing us, that want to experience this incredible opportunity to be one of the first to enjoy what we have to offer at the Mousetrap. So get on the webpage, send us an email, go to our contact page. Everything's right there. Let us know. Leave your phone number. Again, the amount of people and the date that you're interested in, and we'll get back to you right away. In the meantime, stay warm. Spring is coming soon, and so are we. Take care.
Welcome back to Long Island in Crisis. This is such great information, and so thank you so much for coming on, because there's so many people still struggling with all of this and not knowing where to go and what agencies are out there, what are, and as we all know, there's some notoriously not good people around that are sending people to places.
Well, I think we also have to talk about, during the break, we were telling you that both Elaine and I have been involved in the treatment field here in Suffolk County and myself now in Nassau County as well for, I don't know, at least since 1998.
Okay.
And, we've done a lot of work together with all the other funded agencies in regards to being able to stay alive, because for many years our funding every year was at
Yeah.
stake.
Of course.
So we really have been true advocates. We've both been involved with the Suffolk County Quality
Consortium.
Consortium. And about, I don't know, 5 years ago or 7 years ago, we started doing a committee called the Suffolk County Communities of Solutions. And
I've been to your meetings.
You've been to our
I haven't
meetings?
been in a few months, but
Yes.
I have to get back. Yes.
And
Great meetings.
I was one of the original chairs of that committee.
And you're
I'm now back. And it was really started because New York State OASIS challenged counties or people in programs within certain counties to try to come up with solutions to affect change, and with no money, because there's never any money, really.
Right.
So I, being the person that I am, heard the commissioner of OASIS at the time talking about it and say, this would be great to do. And in Suffolk, we have a wonderful county government that pays attention to
They do.
what's going on.
We were just saying that. So the Suffolk
yes.
County legislator.
And the Suffolk
you know,
County
and
Department of Health.
They are parents and they are
Right.
community members. They live here
Right.
in Suffolk County.
Yes.
And they do care.
Yes. And we have the Suffolk County Division of Community Mental Hygiene. And I came down with the idea because Elaine is the chair of the Drug and Alcohol Advisory Subcommittee. And we were all present, and I started talking about communities of solutions, and we all said it's a great idea. And it was data-driven, and we were able to look at what do we need to change within our system. We need to change, we need to improve access to care,
Yes.
and we need to improve quality.
Yes.
We need to make sure that we're doing effective services to have positive outcomes for the individuals that walk in our doors. And not this, well, just sit there and chew gum or whatever,
Yeah.
and this is work, and let's really make sure that people are getting the treatment that they need. So, part of the issues and that we identified was that void in communication. Where do people turn to? People don't know.
People don't know.
And I would say that we've been working very,
Diligently.
thank you, very diligently to try to improve access to care, to tell people about it.
Well, I know we have the tear-off sheets.
Yes, and that
And
came out of
anybody
Suffolk
could
County Communities and
Message
Solutions.
Thomas's Hope Facebook page, and we can get you one of those sheets. The sheets, I remember Nancy Beckett Lawless.
Yes.
And got Suffolk County National Bank, I believe. Or the bank-
Bridgehampton National Bank.
to run them off.
Right.
And that has all services
Right.
throughout Suffolk County. So if
all the drug and
anybody-
alcohol services, whether it's
anybody
detox,
needs
crisis,
something,
yes.
we can get that information to you. We can certainly direct people.
And the
There-
list is expanding.
The list
And we're
is
going to be
huge.
working collaboratively with FIST.
Yes,
We are now, which is Family and
families in support of treatment.
We're also going to be adding where folks can have, if they need to have family treatment or family support, that's going to be added to the list.
That's awesome.
We're also adding to the list with the help of Stony Brook University, which did a survey as to where pregnant women can have treatment in regards to medication-assisted treatment.
And that's a spot that breaks my heart, first off, because these babies being born dependent on opiates,
Yeah,
first off, is heartbreaking.
yes.
Just absolutely heartbreaking. But what a disservice we do as a society, that when a pregnant woman shows up, that we're not doing everything. Because if we can intervene then and we can have a mother who can then take care of her child and be in a good space and not have a baby born dependent on opiates.
Right. There was a very good article on Facebook today about a hospital, I think in Connecticut, which is changing their whole way of thinking on how to work with the addicted mom, and then when they have their child. Because in the old days, and those old days aren't that far away,
Yeah.
they just took the child pretty
Yes.
much away, and they're changing their thinking about that, which is a good thing. I mean, I know that Northwell Huntington Hospital, they've been taking a look at that issue. I know certainly Stony Brook University under Christy Golden has been taking a look at that issue. So it's people are talking, people are trying to find solutions.
Yes.
Which is wonderful.
And having people on a waiting list for, what's the drug I'm thinking of? Methadone
Yes.
in Suffolk County is unacceptable.
Right.
You know, you have people showing up that want, we all know that window opens this much and it closes real fast
That's right.
to somebody looking for help. So when you put all these obstacles in front,
Right.
the disease
Right, yes.
certainly
And
starts
that's
talking.
why we need to have alternatives.
Yeah.
That's also why we need to, and this is something else that we've been talking about at the Suffolk County Communities of Solutions. We need to really, as a field, to be able to service people, and I know it's hard on a weekend, but we need to be able to say to somebody, all right, you're going through this, come down now.
Yes.
And we have to eliminate those obstacles.
Yes.
We also have to eliminate the obstacles of these machines,
Yes.
because people aren't going to come in if they get a machine.
No.
They'll come in if they get to speak to somebody and they see that person is not threatening.
Yes.
So, and that's also
I can tell
Absolutely.
you from the family side of it, when you call up and you get the machine,
it's horrible.
you're already like this. I need to speak to somebody now. You don't understand. You're losing your mind.
Right.
Absolutely.
You've lost your mind.
Yeah.
You've lost your sanity, and you need that personal somebody saying, "It's okay. It's going
Right.
to be okay."
Right.
And that's why if
Right
you
now.
call a Central Nassau Guidance, CN Guidance, you call the town of Smithtown Horizons, you're going to get that live person. You're not going to get a recording.
Many of the communities of solutions agencies now have indicated on that sheet whether they take walk-ins, whether they're bilingual. They start to break down all the different things people seek when they're looking for treatment. So you'll know in a glance what's available to you.
You don't have to leaf through a book saying, oh my goodness.
Right.
Yeah.
I live
Right.
in Huntington. Oh, look, there's 3 or 4 programs in Huntington that I could go to. Or maybe I don't want to go to Huntington because of the stigma. But look, there's these programs in Smithtown,
Yes.
that I can go to.
And here's the thing. Last week, I spoke with Kim Laube out in Sachem. And I never know what's going to come out of my mouth, to be quite honest. I just leave it up to my higher power. But I'm on stigma again, too. I'm not ashamed of my son. If my son had had cancer or diabetes, people would have been very offering and supportive. So if you want to criticize me, you go right ahead. But if you have to look inside my life, there's a lot more wrong with your life. That goes to individuals.
Right.
It's a disease. And especially when we're talking about young adults or teenagers. They made one bad choice that turned on that switch that is now ignited the fire in their brain with this disease. And it's off to the races.
And
And
those,
there's way too many of those kids.
those stereotypical kids that we thought were the drug users.
The
not
bad
case.
kids.
The bad kids,
The bad
right?
kids. They're not bad.
Not
They're all
the kid-
good kids.
Not the case. It goes across every peer group. It goes through the athletic groups, the honor students. There's no one way of identifying this is what's going on and we know who those kids are.
Well, we can go back to 2008 with Natalie Chiappa, was an honor student cheerleader, the perfect all-American girl.
Right.
Died in a garage from a heroin overdose.
But we can go back even further. I mean, when
Yeah.
I got into this field, I was working at Queens Hospital doing case findings on medical boards, going from bed to bed to bed, seeing if somebody had a problem with drugs and alcohol, doing what they now call Esprit. But this
Oh,
is back
okay.
in 1990, doing a grant from what it used to be DAAA, which instead of Oasis, which was
Okay.
the alcohol arm of it, and identifying who needs help and then helping them get a referral to treatment from the hospital bed. And the things that I saw as a new social worker were so eye-opening. And it was the height of the AIDS epidemic. It was the height of the crack epidemic.
Yeah.
You talk about babies being born, and I mean, it's the same, it's so,
You know,
it's
so
so
that's-
similar.
That's why we're so stuck on this heroin and opiate, and it's the disease of addiction. Ultimately,
it is the disease.
Alcohol is still
Yes.
the number one killer
Yes.
of people in the United States. It just takes a
Absolutely.
lot longer with alcohol.
Right.
So it doesn't matter what the drug is,
Right.
because 5 years from now it's going to be something different.
Yeah. Yeah.
So
And that's why we need prevention. And that's why,
We do.
Elaine's program has prevention.
We work on prevention as well. It's really hard to start to change attitudes, community attitudes. We're very, very permissive when it
Yes.
comes to the softer drugs, those alcohol parties and
Parents
and
still say to me,
marijuana. They
"Ma,
think it's
oh,
okay.
my kid's okay. He's just
It's
smoking and
only-
drinking beer. It's fine."
Right,
No, it's
right.
not fine.
It's not. It's not because
It's
we
still
know
against the law.
We know these are
Right.
the substances that are priming the way for other use. People generally have already started experimenting and using. And frankly, there are more deaths around alcohol and accidents and DWIs than heroin. But we turned a very blind eye to that when we look at our kids. We're not saying everybody has to be prohibitionist and it can't be alcohol in our lives. But what we strive for is delay onset of use. Not at 16, not at 17, not at 18. It's not okay. We know the brain hasn't developed until at least 25.
Yes.
Maybe then it's finally fully formed. You can't be introducing substances into that developing brain at these early ages and not think it's not going to have a long-term impact.
When I speak, and I do speak to people in treatment all over the place, and I always ask the same question. What age would you be if you could go back and talk to yourself not to start? And it's 12. It's 10.
It's 11.
It's 10 to 12. 12 used to blow my mind,
Mm-hmm.
but now more and more are saying 10 years old. 10. First, as a society, what are we doing
Right.
Right.
that 10-year-olds need to escape from their lives? Because that's what they're doing.
But even back in 1990, you had the 10-year-olds, you had the 11-year-olds, and it was drinking. So we've gotten far, but we haven't.
No, we haven't.
And it still has to
Two
do with
steps
our own
forward, 4 steps
right,
back.
and it still has to do with our attitudes, and our education, and and our own issues.
Yeah. We're going to be right back after this message.
What are you looking for? You don't even know that. Are you on the ball list? You can't even answer. I'm asking you about it. You gotta be highly skilled. You gotta be highly skilled. You understand that? Are you well versed there? Are you very smart man? Hit me with some funny shit.
My shit's twisted.
Tell me something. Tell me
What do
something.
you have right there?
That's awesome.
Well-
That's a big.
You know damn well.
That's awesome. That's awesome. That's
Sir. Hey, are you interested in or not?
Yes, I am. I see you got twisted.
You see what I'm saying? You understand me? And if you can't whip out answers like that, that man is liable to during a commercial break punch your fucking mouth loose. You understand me? Time is up, sir. You understand me? You're on. You're the man. All right, give me your name now. I'm sorry.
My name is Willie.
Willie, where you working at?
We are twisted. We are awesome. Love it.
Can you repeat that question again?
Galaxy Luxury Coach is a full-service limousine and party bus company. Family-owned and operated, we are an industry leader with over 25 years of experience in providing best-in-class luxury transportation for your special event. Whether it's your precious wedding day, an all-day wine tour out east, your high school prom, that special birthday, or just an amazing night on the town, Our professional chauffeurs stand ready to ensure your special event is truly special. Galaxy Luxury Coach has one of the largest and modern party bus fleets in the New York area. Our party buses are simply nightclubs on wheels. Concert sound systems, light shows, lasers and strobes, multicolor LED lighting brilliantly lights your party bus inside and out. For corporate and more laid-back events, we will cater to your specific needs and requests. What sets Galaxy aside from all others in the luxury transportation industry is our attention to detail in customizing our services to your special event. At Galaxy, it's all about you and your guests. Galaxy customers return time and time again because they know they can trust Galaxy to help deliver those lifetime memorable moments. Step aboard and let your Galaxy experience begin.
Welcome back to Long Island in Crisis. And, you know, we were just getting interrupted because we're having a very nice conversation off air. But we're just talking about being engaged person to person. And why do people start to drink at such a young age? Or why, you know, because you're not feeling connected. You're not feeling connected. You're not feeling, you know, the media does such an incredible job on young people today, what you should be, what you should look like, how much you should weigh, what your accomplishments should be, because in social media, I can make my life look really intriguing. Doesn't have to be true, but somebody out there is going to think, wow, what an incredible life that is. Doesn't have to be true, and then compare it to themselves.
Yeah.
Well, I think kids are having a hard time learning how to be.
How to be,
You know,
how to
and-
just be and not worry
Right. And I think
that everything doesn't need to be in a perfect
Right.
box at the end of the day.
Right. And I think that when you look at a program like Hugs
Yeah.
with Kim, you know, and the prevention work that she does, you know, on
Incredible.
the East End, it is incredible. The work that Elaine and her program does in the, you know, in the community, in the schools.
I did a Hugs weekend on Shelter Island last year, and it was absolutely
Yeah.
life-changing.
Yeah.
Because what these young people shared and what they deal with in their home life and in many aspects, I was absolutely blown away.
Yeah.
Because we talk about the young people being, you know, involved with drugs and alcohol, but a lot of them have other family members
Right.
that,
Yes.
And that's why also, I mean, I live in a community, I'm in the Northport community. And we
oh
have,
my gosh, Anthony Ferradino and
Yes.
Tammy Walsh and
we
Darryl
have-
St. George.
and I've been on the
Task force?
Drug and Alcohol Task Force since its inception. And you know, there's a lot of work, and that's a community. The beauty of that community is that you have the elected officials, you have the school district, you have the community, you have parents, you have the soccer coaches, you have the police.
Everyone's
you have
engaged.
everybody is involved in it,
And they've still had 5 lost lives
and
since
we still
November.
right.
Yes.
Yes.
Yes. But you do mention the soccer coaches, and I'm going to just bring this point
Yes,
up.
this is a
because
very good point,
One of
yes.
the things that came out of the Communities of Solutions when we were looking at access to care and the disconnect, we have kids in need of services, and we had plenty of services available, but they just weren't connecting. So we started to study what was going on. We held a large adolescent forum of over 300 kids. And we had them come in, and we broke them up into little focus groups. And we asked them all basically the same questions. And one of them was, who would you go to? Who would you turn to if you thought you might have a problem with drugs or alcohol? And the list went on and on and on. And we pulled all this information together, and we put it all up on newsprint, and they all went and kind of put red dots next to the answers they thought they best related to. And then we compiled the information and looked at it. And parents, unfortunately, frequently didn't even make the list.
Yeah, it was amazing.
And if they did, they were very, very low on the list. I mean, below things like I would talk to my dog, I would listen to the radio, you know. We learned a lot from that and said, okay, clearly we know where we have to go with some of our effort. But we also looked at who was number 1 on the list. and it was coaches. And we thought to ourselves,
Yeah.
I wonder if they know that. So we also put a lot of energy into getting in touch with all of the high school coaches and all of the local college coaches and presented them with this information and said to them, are you aware you're number one on their list, and are you prepared when they come to you? Do you have questions?
I remember
Can we help you?
we spoke to Section 11.
Yes, we did.
I did speak to them, and in my
Yes,
own
you did.
experience,
Yes.
my son, Andrew, when he found his brother, called his wrestling coach. And Jack Bagnani came to that house and worked on Tom. And I know that left a mark on him because that was his student too.
Yeah.
Sure.
But he certainly wasn't going to leave Andrew, but he never left Andrew's side for the next 3 days.
Right.
Stayed with him through the wake, through everything, and they still the best of friends.
Right.
Because that was what an experience, you know. And Coach Bagnani and I have stayed in touch, and he does call me when he has questions about kids that he has.
Right.
You know, how do we engage them? You know, so Oasis, the kitchen tool kits
Yes.
now,
Yes.
you know, on how to
Yes.
have that open-ended conversation. But I challenge any coach, and it's unfortunate because if they, with any extracurricular activity in school, they should be allowed to be drug tested. Period. End of conversation. Because I'll tell you this, on a football team, we all know there's football parties. We all know that, and people turn a blind eye, or they say those magic words. I'd rather have them drink in my own house so I know what they're doing. Yeah, because that's effective.
Right.
The star football player has to sit out 2 games once. Never going to happen again. Never going to happen again. So what is your policy? It's zero tolerance if you're caught with it.
Right.
First off, parents, and I say this with the greatest of respect, is you need to open your heart and your minds. The school district is not against your child. And when they make that phone call and they say, we think we have a problem, you shouldn't have to have videotape as to why they think you have a problem. They're trying to help you and intervene perhaps at a time when you can get help easier with a kid that's going down the wrong path.
And it need not only be the school's responsibility, nor
No.
should it only be the athletes. Why is it not part of a well-child checkup?
Yes.
To test for substances. You would test for lead. You would test for any other toxin in their body. If they were diabetic, you'd be checking to see what kind of sugar levels they have. Why is this so taboo? Why are parents not pushing for that, just as matter of course?
Because they're afraid of the answer. Period. End of conversation. They're afraid of the answer. And if I don't open the door, then I don't have to deal with
That's
it.
true.
And that's what happens. So, you know, I tell parents all the time, if you think there's something wrong, there's something wrong, and it's been wrong for a long time. So the sooner you know, you could have a little baby monkey in the room or a ginormous gorilla. What are you going to wait for? You know, the signs are there.
Right.
Trust your instinct. Always trust your instinct. But you're going to have to deal with it at some point in time.
Right.
And you really, you know, out of my 3 children, I didn't know that Thomas didn't have the shut-off valve. So 1 in 9, right? Is that still the ratio? 1 in 9 is going to have a problem with substance abuse?
I don't know that they've come up with a number.
I haven't heard that. Yeah.
Okay.
I don't know
But
about
I
that.
know that it's pretty, you know, 1 in 9, 1 in 5, whatever the number is. You don't want your kid to be that one.
Right.
And you know, getting back to that whole stigma thing too, and the whole role of the parent, you know, parents are so afraid to perhaps find out, but they don't think it could be their kid. You know, no parent thinks it's happening, even though it may be happening right in your home. You don't see it. You don't see it because they're working so hard for you not to see it.
Yes.
I mean,
Yes,
and it's
and the
not
other
that you're not
masters of manipulation.
masters,
And they're also your babies.
they're your.
So when you
don't
look at
want
them,
to. You don't want to see it that way. It's very hard to separate. Is that just adolescent behavior?
Absolutely.
Is he sleeping till noon because he's 14, or is he sleeping till noon because he's doing some drugs? It's
Yeah.
so hard to tell.
It is very hard to
It's a fine
tell.
line.
Yes.
And it's not a statement about good parent, bad parent. Every parent needs to really monitor what's going on and not be afraid to
it really
look
has
and find
nothing to do with the parent.
out. No.
They made a mistake by trying a substance. They did, and then it's off to the races. Let's face it.
Yeah.
You know, there are kids that can have a few beers and be done with it.
Mm-hmm.
And there's going to be the other one that says, I want more of that. I want more of that. I want to do this now. I want to do that now.
And that brings us back to why programs like ours are so invaluable,
Yes.
you know, and so necessary. And to be able to, you know, come on a show like yours and really be able to talk about it and to get it out there as to what's available. Because people don't know, and people are scared, and people are stigmatized, you know, and people are full
People
of
are
shame.
scared. They're just
Yeah.
scared.
Yeah.
You know?
But I think the more that we talk about it, the more that we normalize it, the more that we educate, we do have the opportunity and the ability to be able to decrease what's going on. You know, and it's
the crazy thing is that in every family is touched by this at some point in time, somewhere along the way. So if we all just let go of the stigma, just it's really not a statement against your family. It's,
Right.
It's
It's
nothing.
a medical issue.
It's a medical
Treat it.
issue. Yes.
Just treat it.
Just treat it. It's not a failing. It's not a failing by parents. It's certainly not a failing by the child. It's not a failing by anybody.
Right.
It's a medical condition. Would you blame, you know, a loved one for getting diabetes?
well, somebody might.
Well, that's true. You know what? That's true. And we'll be right back after this message.
Hi, I'm Tom Mealy from Madhouse TV, and when I'm not at the studio, I'm here at the Harrison Law Group. This is my real job. And this January 2015, Brett and I are putting together a show called Legal Straight Talk. It'll be aired on Cablevision as well as here at Madhouse TV. You need to tune in. This information that we're going to be giving the public is the real deal. It's all about what you should do, what you shouldn't do. So tune in this January 2015 for a new episode of Legal Straight Talk.
Welcome to Formula Auto Wash, where every day is a great day for a car wash. Open 7 days a week from 8 a.m. till 5:30 p.m. Sundays 8 a.m. till 4 p.m. Detailing packages for every budget, starting out at $29.99. 100% hand wash and detail centre. Hogshair and microfiber brushes and mitts. Proudly used in Ecolab Blue Coral soaps and waxes. Formula Auto Wash has served the community for over 30 years. Senior discounts all day, every day. Ladies' Day Wednesday, $3 off any wash. Early bird discount Monday through Thursday till 9:30 a.m.
Yo, what's up, y'all? This is me, DMC, in the place to be, the greatest MC in history. There will never be an MC greater than me. And right about now, the only place for you to be is with the one and only Madhouse TV.
You are the man.
Welcome back to Long Island in Crisis. So, town of Smithtown Horizons, I know I would like you back. Kings Park High School used to have you guys
Oh, yes.
in there, and
Yes.
for whatever the reason, you know, and let's talk about that in our outside voices. So school districts who say, we can't have a prevention program because people will think we have a problem.
Right.
You all have a problem. We all, as a society, have a problem.
Right.
But do we teach our kids how to ride a bike and tie their shoes and basic principles of math,
Right.
English,
Right.
and everything
Right.
else? They need coping skills.
Right.
They need to learn how to negotiate life
Yes.
on life's terms.
Yes. Yes.
We're not teaching that. We're not
No.
teaching it in school. Not everybody gets a trophy, and I always like to go back to that. There's winner. Life is going to knock you down. Let life knock your kids down a little bit, because if they don't know how to get back up, what have you taught them? Right?
Well said.
I don't know how else to say it.
Absolutely.
You know,
You're absolutely
there's
right.
always, not everybody gets to win.
That's
And
right.
if your child gets a bad grade, there's a reason why your child got a bad grade. You can't fix that. And if they have a personality problem, they're going to have personality problems going through life. Not everybody's going to like you. Learn how to deal with it. It's not the end of the world. But those are the learning opportunities that we each get,
Yes.
right? There's always that little window to teach a little something about life. It's not about getting, parents crack me up, you know, and I'm like, why are you worried about the SATs? You should be worried about keeping your kid alive. So they graduate college at 25, 26. Who cares? Really? Is it a race? Is 22 the magic age?
Right.
Everybody's different. You know, sometimes I think we all live a little too vicariously through the kids. Let them be and do who they need to be and do.
Yes. Our children are so competitive. They're always self-assessing. They're comparing themselves to their peers. And parents say, I don't know how to deal with this peer pressure. And yet, I can't help but think, where are they learning this? Where's
Yes.
this competition coming from? We're all pushing our kid to the front of the line. We all
Yes.
want our kid to get that trophy. We want to be at the winner's table. We want to show them off. We want to be proud of their accomplishments. Nobody sees the value in the losses, because that's where you learn. You don't learn anything when you've won something. You learn from your failures. You learn from your
Absolutely.
mishaps. You learn from the things that didn't go well. Now you have to change what you're doing. Now you have to alter your behavior. Now you have to
Yes.
grow. These are valuable, very valuable skills for kids, and you're absolutely right. We protect them from those failures. We keep
We
pushing
protect them from life.
and we protect them from
And life is going to knock you down.
Right.
It's not if,
Right.
it's when.
Right.
So, you know,
Absolutely.
there,
Absolutely.
and I've said this quite a few times now. I'm the youngest in a family of 5, and I have brothers. So I've gotten knocked down quite a few times.
Yeah.
But it's all learning how to negotiate. But
Right.
especially my brothers, there was, you know, if there was a problem in school, there were a lot of meetings at that flagpole at 3 o'clock in the afternoon for a discussion, whatever that included. But that's how you know, if you let kids work things out, they do work things out a lot faster than any adult can work it out, because they're objective. They're going to be friends long before you've even gotten off the phone to interfere, right? So, again, if your child's not doing their homework for the whole semester and then you expect the teacher not to give them a bad grade for that,
Right.
who's right and who's wrong?
Right.
Because I will tell you, speaking to teachers, they're intimidated. They're afraid. You know, it used to be the kid used to be afraid if the principal called. Now the principal is afraid of the parents and everybody else coming up. Something's not right there.
Yeah.
We've lost that. I know if somebody said, I'm going to call home, just kill me now. I don't even want to go home. But there was that fear, right?
Yes.
It was that fear of.
Sure, and if you got in trouble in school, you got in trouble at home, and your extended family members knew about it, and your neighbors knew about it.
Oh, yeah.
And they were all in agreement.
We need to go
But
back
we don't
to the
have that
community
anymore.
parenting
Right.
again.
Yeah.
Because if I was someplace I wasn't supposed to be, by the time I got home, my parents already knew that I was someplace I wasn't supposed to be. And they always ask that magic question, and then you're saying, do I lie? Because I'm probably going to be even in more trouble.
But just also think about what's happening with all these parents that have their kids. They're always having to do something.
Yes.
So the child doesn't even have the opportunity to be off for 10 minutes by themselves.
Yeah.
But you also raise a good point. You know, when our kids are young, we kind of circle the wagons, and we know all of the other moms, and we know their friends' parents, and, you know, we're really keeping a close eye. As our kids get older and hit the teens, and they're pulling away, we let them go.
9th grade.
And we let that wagon circle go too. If ever you need to, you know, stay connected to those other parents.
I'm a financial advisor. That's what I do for work. So when parents say, well, I'd like to be able to take off, I go, work till they're 12, then take off. When they're little, they have little problems. Little people, little problems, not really going to be mind-boggling things. More physical problems, you know, little people, little problems.
Yeah.
So come back when they really need you home, when they really need to question. You need to question, where are you going, what are you doing, and who are you going with?
Right.
Because that's the time that they need our attention the most. Because they're equally as scared.
Yeah.
They don't know how to navigate this world.
Right.
And then you got that, you know, that sounds like a great idea. Let's go jump off that, you know, not so great.
Right. Right.
So you are located, what's right across the street actually from the diner at Route 111.
That's right.
161.
161 East Main.
East Main
Right
Street.
across from what used to be the Dairy Barn.
The Dairy Barn and the big white church is at the corner.
Big
Yes.
white church is right there next to us.
And we're
just east of
located
us.
upstairs in the same building.
Okay.
And we're also located in Hicksville at 950 South Oyster Bay Road.
950 South Oyster Bay Road. If anybody has any questions or problems, you can reach out to Thomas's Hope Facebook page, and I will get your information to these two great ladies. And, you know, no one's criticizing anybody here. Nobody's judging. We're just trying to share, certainly what I've learned in my journey, and I don't want any more members of a club that no parent should belong to. So we need to do better because we know better now. So there are resources available that can be tailor-made to your budget. If you don't have insurance, certainly they'll work with your insurance and with your Medicaid. Earliest intervention, appropriate level of care. We have Suboxone now.
Vivitrol.
There are other tools in the toolbox, but all the tools have to be used.
Right.
It's not handled by just medicine or a shot.
Right.
Have to do the tough work on yourself.
Yes.
Have a great week, and thank you for joining us tonight, and thank you guys so much for
Thank
coming
you too,
on.
very
Thank
much.
you
We
for
will have
having
you
us.
back
I appreciate
for
it.
sure.
Thank you.
Thank you. Have a great week.
Another dark hotel room, musty people.